Okay, we're back after the meal break with Enrico. We're going to talk about surgery setup and appliances. Over to you, Simon.
So that was a good lead in, because obviously appliances are a big part of the mechanics of postural orthodontics. And what we're going to do now is talk about how I set up my surgery and the appliances that I use and what they look like and some of the aspects of creating appliances and using appliances. Okay, so I run a children's only practice, and it's built to cater for the pre-teenage child. We are very into visual presentations. So part of the secrets to treatment planning and case presentation is imagery. So we have to have very clear records that give us the opportunity to show rather than just tell. The clinic is, it's a small clinic. I have two chairs set up. I work with a hygienist, therapist, hygienist, and it is a stand-up only practice, so we don't sit. The rooms are interconnected, and we work at a fairly fast pace. Appointment schedules are 15 minutes each, and we run two chairs simultaneously. So we do a merry-go-round with me starting and my hygienist finishing, and then sometimes her starting and me finishing. And we can see a lot of patients throughout the day and still provide a good level of care. The backbone of records is your photographic equipment, and I implore you to not skimp out on your photography. So it's important to have appropriately sized mirrors, retractors. We use hot water to defog the mirrors, and I favor the use of SLR macro telephoto lens. I use both Canon and Nikon. It's just whatever suits you, but I prefer the ring flash. We have a very small armamentarium, so there's not a lot of tools that are needed for postural orthodontics. We need bird beak pliers, we need 3-prong pliers, some bowler gauges, wire cutters, and straight handpiece is really all you need. The 3-prong pliers all have different sizes, and we tend to like to use the finer sizes. The adjustments are very simple. I just have some pliers. Straight handpieces and straight handpiece acrylic burrs are a really important part of what we do. And hot water for warming the mirrors, and I have a grind box in my clinic setup. We just have a lab grind box with a little desk lamp, and I use a laptop stand that I bolted to the corner of the table. Impression materials, I just use Chromapan, just orthodontic color change fast set impression material. And for the bites, I tend to use PVS registration rather than wax. So Chromapan 100 impressions would be acceptable after 48 hours and 100 hours of storage. So, you know, the material that we use is very stable and has been shown to be very stable. For those who are overseas and want to use Enrico, obviously you're better off to scan. So, you know, iTero scan or one of those scans that many of us use nowadays with our Crown and Bridge. If you're still wet-handed and using the alginate impressions, then you need to have appropriately sized trays. I like Pegasus trays because it goes from adult sizes all the way down to the smallest pediatric sizes. So it's important to have correctly sized trays if you're treating young children. So if you don't use the right size trays, you won't be able to achieve the goal of getting good impressions. You can see the difference in size between an adult and a child. If you don't have the tray, you can't treat the child. We use different supplemental materials. I use a chair-side denture repair powder liquid called Cool Liner from GC, and we also have glues that are quite useful when things break in the acrylic. So part of the process of what we do is posture. We've created a 7-step framework, and prevention and position, where the cause and cure is the position of tongue and lips and tongue. Oral posture exercises, the GOPEX training, chewing, speaking, and general posture is critical to our stability and growth and the right direction of growth. Structural rebalancing of jaws. We're looking at, if you like, widgets that work. So appliances that are able to create changes in the structure. Treatment planning, and it's important to use evidence-based protocol. Unwavering discipline. This is one of the things that, like I know a lot of you come from an Asian background, and martial arts is a big part of many people's growing up. And, discipline and commitment is important. And, let's take, for example, the Olympic Games. So right now, we have the peak of humanity trying to show their prowess on the athletics field and in the swimming pool and in the gymnasiums. And they're there because they have unwavering discipline, and they want to be winners. And that's part of that process of how do you find the right patients? Well, you just have to have someone who really wants treatment, who wants early intervention, who wants something that creates a bigger change than just aligning the front teeth. Return on investment, results for your patient. You have to deliver results. You cannot run a practice that misses the mark all the time. You have to have consistency. You'll never cut a crown if every second one fails. You'll never cut a crown if every third one ends up with an endo. You just have to deliver. You have to deliver on your promise, and that will give you a return on your investment. And ultimately, you have to educate yourself, and you have to educate your parents and educate your patients, and that's what creates the motivation to make a postural change. So the nuts and bolts of it, the appliances. So fundamental to what we use are appliances that were originally designed by John Mew, and he called these the Bi-Block Stage 1 appliances. And they're acrylic-based removable appliances that expand the maxilla. And his focus was expansion of the maxilla. Use a large gauge screw, which can expand up to 10 millimeters. And we have crescent clasps that grip onto, ideally, second primary molars. We have rests that sit on first permanent molars. And we have wires that help us to create changes in the alignment of the anterior teeth. I created a lower expanding appliance, which is a hybrid combination from Schwartz and John Mew's lower stage 1 and various other appliances that I've used in the past. We have had very, very good success. It is an appliance that sits heavily against the dental alveolar bone and sits low into the sulcus, and it seems to create a nice flattening of the curve of Wilson, which is our primary goal. We have wires, again, that fit nicely against the lower teeth and create a lingual effect that can align lower incisors quite nicely. Some people always ask, what happens when you have a lingually erupted lateral incisor? And the answer is, well, if you create an appliance that allows for that, you can make some changes. So in situ, they take up a lot of space. They sit in the mouth and they eat up a lot of space. And a lot of people are always a bit confused. You know, they're saying, you know, it's really, really important to have good posture where your mouth is closed and the tongue sits against the palate. Yet you have appliances that eat up almost all the tongue space. You know, why, where it's a paradox. It's a paradox, right? It's not following the philosophy of good posture. And my answer to you is this. The children have never spent time with their mouth closed. They have spent 5 years, 6 years, 10 years with their mouth all the way open. Yes, this appliance does not allow for good tongue posture and good oral posture. But these appliances are in for a relatively short time. And what do I care if their mouth is open for a few months longer if they've already spent 7 years with their mouth open? What these appliances do is they stimulate bony development and they mimic the form that the tongue would normally take if the posture was good. So they're what we call tongue substitutes. They're not the real thing, but they are a sub-in while the tongue is still not in the game. So what they do is they have to have a certain size and they have to have a certain bulk in order to trick the body into believing that everything is as it should be. And once we've created the space, then they come out and we train the child to use that space wisely. Because you've got to make the structural changes before you can train them to do the right thing.